which I think caused more anxiety, and it's anxiety we're dealing with now. CDC says, if you want a test, go get a test and tell your doctor you want a test, and it's up to your doctor. That was the message, the reported message of the CDC. At the same time, the vice president says, oh, by the way, we don't have the capacity to do the tests. Well, now you created a real problem. You invited people into the house, and you can't serve them. You said to people, come in, get a test. All that has to happen is your doctor approves it. By the way, we can't do the tests. That's now reverberating and making people very nervous, because we have a lot of people calling saying, I want the test. Well, we can't really handle that amount of tests right now. And if you're not in a certain protocol for the tests, we can't get to you yet. Well, I heard the CDC said all I had to do was go in and ask my doctor. I know, but really, if you listen to the vice president, he also said we don't have the capacity. That has caused consternation, anxiety, and worse than the virus. You know what's worse than the virus? The anxiety and the fear and the confusion. So that was not helpful. You cannot invite more people for the test than you have the capacity to test. Sounds like common sense, right? 1 + 1 + 1 still has to equal 3. And that's what we're doing in New York. We have a protocol on prioritization of tests that fits our capacity. As our capacity to test grows, we will expand our protocols for who can get tested. But the protocol for who can get tested has to match the capacity. The number coming in to the pipeline has to equate with the number going out of the pipeline.
Governor, we've seen a number of big events be canceled throughout the country in recent days. What would your message be to somebody in New York who might be hosting a convention, I don't know, a basketball game, a concert? Should those go ahead at this point?
My message would be, if you are a senior citizen or immune compromised, I would think seriously about attending a large gathering now. I've said that to my mother. My mother is a elderly person. She doesn't know it or believe it or act like it, but she is. I've said to her, I would not be going to large gatherings. I would be using hand sanitizer when you're moving around the city. She lives in New York City. But in terms of closing any gatherings, if that's going to happen anywhere, it's going to happen in New Rochelle. We have a situation in New Rochelle. You're seeing those numbers in New Rochelle expand as you have seen in other clusters around the country. And 1 becomes 2, becomes 4, becomes 10, becomes 12. And 12 people then go out, and 12 people touch 200, and 200 touch 400, and 400 touch 800. And that's what we're now dealing with. That's where you start to come up with no large gatherings, et cetera. We are closing the schools in that community. We have closed the schools. We may extend the closing of those schools. Today we're expanding it to precautions with nursing homes, senior care facilities, et cetera. If there were any large gatherings imminent, which again, I just spoke with the local officials, we don't have any large gatherings imminent, but if there were, I think we'd have to take a hard look as to whether or not we would cancel them.
What does the state of emergency allow? What are the parameters to that?
It allows expedited purchasing and expedited hiring, which are the things that we need now.
That's above and beyond the 40 million that you asked the legislature for?
Yeah, well, I needed to spend the $40 million. $40 million of budget appropriation. That's how you pay what you purchased. The purchasing requirements, some of the purchasing protocols are waived during an emergency declaration. Timelines for an RFP, et cetera.
Governor, do you have any update on the SUNY students that were supposed to be called back from abroad?
They are coming back. They're not going to land. The airline doesn't want to land at Stewart Airport. The airline wants to land at Kennedy Airport because they have more personnel, more services at Kennedy Airport. We said, fine. The general parameter is if they can home quarantine, fine. If they can't home quarantine, we'll have SUNY congregate dorms for home quarantine. Do we have anything new there?
73 is the number, sir, on the airplane as it lifted off.
Sorry, can you repeat that?
There are 73 students that were on the flight, which is now on its way back.
Can you break down the state's $30 million in spending weekly? What is that going towards?
It's going towards everything. It will be going towards staff hiring, equipment purchasing. We're purchasing swabs. We're trying to purchase masks. We're trying to purchase protective equipment. We pay for the tests, those 6 private labs that are doing the testing. We will be paying for that testing. Local housing authorities need funding because they're incurring overtime, et cetera. So it's things like that.
How much do those tests cost?
We're still working that out.
Governor, my name is Jill Knock. I'm a reporter at News Channel 13. So on a scale of 1 to 10, how would you rate the public health risk for New Yorkers at this stage of the game?
Low. Look, we have a lot of frenzy, a lot of number, a lot of activities, and then we have an underlying reality. What is the underlying reality? What John Hopkins says, yes, this is a very contagious virus, and it is contagious. It's easily transmitted. But the bottom line is, okay, so what happens if I get it? What happens if I get it today? I don't consider myself elderly. That's the caveat, okay? 80% self-resolve, 20% hospitalization. Underlying illness, if you have an underlying respiratory illness, this could be very serious. If you have a compromised immune system, this could be very serious. If you're battling cancer or you're HIV positive, this could be very serious. If you already have pneumonia, this could be very serious. Otherwise, you will basically have symptoms for 2 weeks, and you will recover.
Just playing devil's advocate here, what happens in the event that New York's healthcare system becomes overwhelmed down the line?
Don't let it become overwhelmed.
Governor,
And look at the numbers. We have the numbers, look at the numbers of people, the rate of people who are being hospitalized, right? You take, well, Johns Hopkins doesn't say how many are hospitalized, but we have 76 people, 10 in hospitals, 15% hospitalization rate.
Have you ever thought about manning like a 24-hour hotline with medical professionals for New Yorkers that might be interested in talking to a person around the clock if they have concerns?
We are now looking at telemedicine. We're studying what China did. You know, China went both ways. They sort of got caught flat-footed when it started, depending on who you believe, by the way. But then they turned the corner, and they got very aggressive about the handling of it. Very aggressive with quarantine, by the way, which the post-mortem is China's aggressiveness with the quarantine was a big reason they turned the numbers around. But telemedicine was part of that. Mandatory quarantine, staying home, work from home, closed schools, closed restaurants, food deliveries to the home. They were very quick and aggressive on their implementation of quarantine aspects. They would say, even if you look at South Korea, they would say the only way to stop the spread is an aggressive containment strategy. And when you look at New Rochelle, look at the increase in those numbers in New Rochelle. They are very high, right? Since it started, it has just continued to increase dramatically. Well, if you had said day one, everyone in New Rochelle, you must stay in your home. Yeah, it could have reduced the rate. Mandatory quarantine for everyone. Now, see, that's easier to do in China, you know. But it'd be highly disruptive to the economy. But there's no doubt that massive quarantine is the best way to slow the spread.
One quick thing, sorry Jesse, one quick thing. On the hotline, there is actually a hotline that if New Yorkers have questions about their previous travel or any symptoms they're having, it's 888-364-3065.
How many tests are pending at this point? With that number, because it's not on PRH.
How many tests of what?
Tests are pending, so
How many open tests?
open tests?
How many open tests? What do we think?
Well, in Westchester, that's ongoing testing.
We have ongoing testing in Westchester. It's
It's more than
Dozens.
dozens. I can get it to you right afterwards.
Is it one test kit that can reach or can test up to 500 people?
No.
Is that, what is,
There is one test kit per person.
okay, thank you.
You get sampled, we call it sampled, one sampling kit, you get sampled, the sample gets sent to the lab runs the test. We need CDC. This is the third engagement with our federal colleagues. We needed CDC to authorize the state lab. They finally did. We need CDC to authorize the state lab to contract with outside labs. They finally did. We now need the CDC to authorize automated testing, which is robotic testing, which exponentially increases the number of tests that you can do because they're not manual. You don't have a person manually adding the agents to the test tube, et cetera.
Governor Trump said yesterday he wants to keep the passengers on a cruise ship off the coast of San Francisco on the ship because he doesn't want more positive test cases. It seems like they're taking the opposite approach, saying more positive test cases are good because we know who to protect. Is that intentional? And any concern, like conflicting approaches, would hinder more federal aid or the things you're asking for from the CDC?
Well, a cruise ship is a little bit of a different situation because they are by definition isolated. They could only spread to that universe on the cruise ship. What we're dealing with is people who are walking around the community, and somebody's going into a hardware store and then going into a restaurant and then going to a place of business and an office. In that situation where you have the potential that a person will be contacting people who are not informed and not wary of this situation, that's a much different situation.
In Washington, a nursing home is at the center of the coronavirus outbreak, and there's been, I think, about a dozen deaths so far. How is the state preparing to deal with this virus if it does get to a nursing home or retirement facility? Are there any regulations, protocols to ensure that it stays contained or proper medical treatment is?
Yeah, look, that has been from day one. That is really, if you ask me what's this all about on the bottom line, what do we have to worry about? I've said to you from day one, we have to worry about nursing homes. They have been given specific guidance, specific protocols, specific instructions to the staff. New Rochelle, we're going to be taking an added precaution, no outside visitors. But that is what I worry about. That's what keeps me up at night.
Can you detail what the guidance is or protocols?
We can get that for you. And believe me, the nursing homes are well aware of this. And we've discussed a number of things. will say no outside visitors to any nursing home. You know, but that's tough too. That means a person in a nursing home, their family can't come, their children can't come. So all of these things are a balance and a trade-off.
All right, thanks, guys.
Thank you.